First of all, head trauma is a very common presenting complaint, not only to emergency departments in the United States, but even to general practitioners' offices. And over the last 20 years, the use of CT scans has increased dramatically. We did a very large study on more than 40,000 head injured children a number of years ago to create a prediction rule to help clinicians decide which children do not need CT scans. And in that rule, we identified between 50 to 60% of children who, if they don't have any of 6 factors, they don't need CT scans. What this study and other studies that we've done in the last couple of years are trying to tease out is that those patients that might have just one of those PCARN factors, do those patients need CT scans or not? And what we found with isolated loss of consciousness, again, loss of consciousness without any other signs or symptoms of brain injury, those children can be observed. But what I mean by observed is observed for a period in the clinic or in your emergency department for a few hours to make sure that they're not developing any signs of brain injury. And if they don't, they can safely be discharged to home. This particular factor is really important because nationwide, it drives perhaps a quarter of CT scan use. That is, physicians feel, wow, this adult, this child had a history of loss of consciousness, they need a CAT scan. And we wanted to address that particular notion because what does make sense is that if you have loss of consciousness, it is a marker that you might have serious injury, but typically you'll have other symptoms as well. We wanted to identify if you have loss of consciousness alone and no other symptoms of serious head injury, is that still a reasonable indication to get a CT scan? We realized that we really need a way to engage parents better about the risks, but not to scare them from the CT scan, because again, it is a very good piece of technology when it's indicated. What our evidence does is it identifies when it's indicated and when it's not indicated. And by all means, when it's indicated, we want it used, but we just don't want it used when it's not indicated.